Hello, everyone. My name is Karishma, and I'd like to thank you for being here today. I'd like to open by acknowledging and recognizing the traditional custodians of the land we are gathered on today, and honor the elders who have come before us, and those who guide us now, and those who would lead in the future. I also extend my respect to any Aboriginal and Torres Strait Islander people joining us here today. In this presentation, I will be discussing intergenerational trauma and how it affects Aboriginal and Torres Strait Islander people, particularly within mental health settings. As nurses, we often engage with people during moments of crisis. For Indigenous clients, these crises may be deeply rooted in complex trauma that spans generations. Aboriginal and Torres Strait Islander health is not just about physical well-being. It includes emotional, spiritual, social, and cultural well-being and is closely tied to community and connection to country. Colonization, the forced removal of children, cultural suppression, and ongoing systematic discrimination have created a cycle of trauma that continues to impact the mental health of many Aboriginal people today. As mental health nurses, understanding this trauma is key to delivering effective, compassionate, and culturally safe care. Intergenerational trauma refers to trauma that is passed down from one generation to the next. For Aboriginal and Torres Strait Islander peoples, this trauma comes from events such as the loss of land, culture, language, and the devastating effects of policies like the stolen generations. These traumatic experiences can result in long term psychological, emotional, and spiritual harm. When unresolved, these impacts are often passed from parents to children, creating cycles of grief, loss, and emotional distress. In mental health settings, this can lead to a range of presentations. Indigenous patients may exhibit fear, anger, mistrust, or withdrawal. These behaviors are sometimes misunderstood by staff and misinterpreted as noncompliance, resistance, or aggression. Without an understanding of intergenerational trauma, we risk reinforcing harm. Aboriginal people are unevenly represented in mental health services and are more likely to experience involuntary treatment and seclusion. These interactions can re traumatize patients and erode trust in the health system. It is crucial that we shift our focus from simply managing behaviors to understanding the reason behind them. Intergenerational trauma helps explain why some Indigenous patients may find hospital environments unsafe or struggle to engage with mental health services. Mental health nurses play a vital role in supporting healing and improving outcomes for Aboriginal and Torres Strait Islander patients. Our role begins with creating a safe, respectful, and trauma informed environment. We must view behaviors not as problems, but as protective responses to a long history of trauma and adversity. Using trauma informed care principles is essential. This approach recognizes the signs of trauma and prioritizes safety, trust, and empowerment in every interaction. It also helps reduce the risk of re traumatization. For example, rather than using a controlling approach, we can offer choices, involve patients in decision making, and show compassion in times of distress. We also need to practice cultural humility, acknowledging our own limitations, being open to learning, and recognizing that Aboriginal people are experts in their own cultural identity and health needs. Building respectful, collaborative relationships with patients and their family support better engagement and recovery. As nurses, we have an ethical responsibility to provide culturally safe care. This means care that is free from racism, bias, and judgment. It also means advocating for the inclusion of Aboriginal voices in care, planning, and ensuring our workplaces support culturally responsive practice. Collaborating with Aboriginal health workers, mental health clinicians, and liaison officers is another key responsibility. Their knowledge and cultural understanding are invaluable in building trust and bridging gaps in care. By listening to and working with Indigenous staff and patients, we can challenge institutional bias and support more meaningful healing. To support Indigenous patients affected by intergenerational trauma, we must go beyond good intentions and implement practical, evidence based strategies in our mental health wards. Firstly, cultural safety and trauma informed care training should be mandatory for all staff. The training should be co designed and delivered by Indigenous educators, and it should encourage reflective practice rather than just information delivery. Second, we need to create visibly inclusive spaces. This might include displaying the Indigenous flags, incorporating artwork from local artists, providing access to yarning spaces, and creating quiet areas where cultural or spiritual practices can take place. These seemingly small gestures can go a long way in making people feel safe and seen. Third, embedding Aboriginal mental health workers and liaison officers into daily ward routines ensures that cultural knowledge is part of clinical decision making. Their presence can also support non-Indigenous staff in developing their cultural competence and provide patients with a sense of familiarity and safety. Fourth, we should use culturally relevant assessment frameworks, such as a social and emotional well-being model. This framework goes beyond Western diagnostic tools by recognizing the importance of cultural identity, family, spirituality, and connection to land. Incorporating this perspective into care planning helps patients feel understood and respected. Fifth, we must partner with Aboriginal community controlled health organizations and elders in care planning, discharge, and follow up. These organizations offer culturally appropriate support that complements hospital based care and ensures continuity of care post discharge. Finally, supporting staff with reflective supervision is important. Talking about difficult cases, confronting unconscious bias, and sharing success can help staff grow and avoid burnout when working with trauma affected populations. So, where does this leave us? Intergenerational trauma is a critical issue in Aboriginal and Torres Strait Islander mental health. It is not something for the past. It continues to shape how people engage with services today. As nurses, we are uniquely positioned to provide compassionate, culturally safe care that supports healing, not harm. By embedding trauma informed practices, listening deeply, and working in true partnership with Aboriginal communities, we can begin to restore and contribute to better health outcomes. Let's use our role not just to care, but to understand, advocate, and change the way our system supports Aboriginal and Torres Strait Islander people. Thank you.